Greetings, my name is Bob Hindle and I'm with Neighbors for Life, and I thank you for coming to our website www.neighborsforlife.org. Another premise is Medicare cuts. Medicare, huge program that is currently on the road to becoming bankrupt and certainly adds significantly to the cost of health care in our country. Most of the cost, and most of us are aware of this, happens at the end of life, where people have significant medical needs and therefore the need for medical care and specialized attention grows, it becomes greater. And President Obama's solution to this, and the Congress's solution to this, is simply cut Medicare benefits. $450 billion cut from Medicare Advantage. Don't pay the doctors as much, and just cut the cost. Might work. Might, conceivably, if you diminish the cost of the entire system, that will trickle down to all the insured and our premiums, etc. Possibility. What's another tenet of this program? Another tenet is the tenet of health insurance exchanges. Now this one is a very, very interesting concept. It's somewhat of a novel concept. Health insurance exchanges are basically an effort to bring in more people into Medicaid and more people into low-income and minimum benefit insurance packages. Now let me explain. Under this bill, both the House and the Senate propose to expand Medicaid to 133% of poverty level. So this is all this effort to get these 30 to 40 million new people into the system. The problem is we don't have insurance programs that will absorb those people. So they propose, let's set up some insurance companies run by the state that will be able to absorb them and provide minimum level benefits. Oh, this is not a public option, by the way. These are state-run programs, not federally run. But of course, they are paid with federal dollars. Okay, so these are the main tenets of this healthcare overhaul. First one is, of course, significant government involvement in hospitals, with doctors, with insurance companies, etc. The second one, mandatory coverage, including a mandate for employers to cover their employees. Thirdly, Medicare cuts to the tune of $450 billion. And fourthly, health insurance exchanges, state-run but federally subsidized health insurance companies that will enable the low-income people to get coverage. On the surface, a lot of this sounds reasonable. Notice it doesn't include any of the things I mentioned earlier: tort reform, cross-state line insurance, competition. Includes none of that. But on the surface, if we look at this, it seems reasonable if the government pushes people to cut costs and literally cut costs, if it mandates people to get insurance, if it introduces a mechanism, i.e. these health insurance exchanges, so that they truly can get low income or low cost insurance. On the surface it looks like it might work. But again, I have to return to a little bit of my engineering disposition and take a more careful look at how this all would work out. So let's take a look at it just briefly. What about the first point, government involvement? Government is going to say, hey doctors, you're getting paid too much, we're going to cut your payments. Medicare now is going to pay only 20% less of what it's been paying. You know, I know quite a number of doctors who are very altruistic and do wonderful things. I mean, they go out, they do mission work, they work here in the cities, they do free clinics. But I wouldn't say that they represent the majority of doctors in this country. The majority of doctors are like the rest of us. They're trying to make a living. And when someone tells you, hey, guess what? We're going to pay you 20% less for your work. What do you think those doctors are going to do? Well, the obvious. They're going to start curtailing their Medicare practice. They're going to start seeing fewer and fewer Medicare patients. What does that do? Well, the first thing it does is it decreases access to care for the elderly. Secondly, because there are fewer providers, it increases cost. I thought the presenting problem was to decrease cost and increase access, but this solution seems to be increasing cost and decreasing access. Next one, mandatory insurance. Mandatory insurance sounds like a good idea. You tell people either you get insurance or you'll be fined. So, well, of course, you know, the obedient citizen should then get insurance. But is that actually true? Let's look at the population of people who are without insurance. I'll exemplify it with myself. I don't have health care insurance, not because per se I can't afford it, but because it's not cost effective. I'd have to buy in this state insurance that would be a $10,000 deductible at $200 a month. I mean, that's not worth it to me. And there are many, many, many people like myself who will make that cost calculation. They will say, hey, you know, I'm earning 30 grand, it's going to be, 5% of my income, so $1,500 a year for health care insurance. I could get that, or I could pay $750 as a fine. Well, guess what they're going to do? And guess what will happen, and this is exactly what happened in Massachusetts, when they have medical needs. You got it. It will be covered by the system, and who's paying for it? Those who already are insured. Guess what happens to their premiums? So again, the attempt to have greater access, people do not have more access. They're not going to buy more insurance. Goes down. And the attempt to decrease costs fails under this mandatory insurance proposal. In fact, the cost will go up for everyone who already has insurance. There's another aspect that I should mention, and it's very important for those of you who might be watching who have insurance plans and really like your insurance plans. President Obama promised that he would not have anyone mandated to change their insurance plans. And that actually is true according to the reading of this legislation, but the effect of the legislation is as follows. An employer is going to look at it this way. They're going to say, all right, we have to cover our people now. But it doesn't say under what conditions. We're going to decrease their benefits and increase their contribution to their health insurance. In other words, their insurance coverage will nominally be the same, but it will cost more and have fewer benefits. I thought President Obama said that people's insurance plans wouldn't change. All right, Medicare cuts. Medicare cuts, that seems to have the effect of decreasing cost, but does it really decrease cost? Well, again, Medicare Advantage is the program that this legislation wants to cut from, $450 billion. Who are the people who are on Medicare Advantage? By and large, interestingly enough, they are not the wealthy. They are senior citizens who have special medical needs and therefore will pay a little bit more for health care in order to have those needs addressed. By cutting this, as I mentioned before, what will happen is doctors will shy away from those Medicare practices. There will be fewer doctors, therefore access will be decreased, and of course the cost will go up. Now we get to the health insurance exchanges, and I want to relate this to a big mission of ours, namely to stop tax funding of abortion.